Okay, so now we're going to do swayback. And a lot of swayback, we're going to actually refer back to the upper cross syndrome video, because that's going to have a lot of what anyone with swayback or flatback needs, and also the biomechanical lifting video. But particularly for someone with swayback, they're going to be weak in the lower abs and the hip flexors. So you can work some type of sit-up movement, and it's okay if they use their hip flexors a little bit. So you can go ahead and anchor it, and I'm just anchoring it like this. And you really don't need to go all the way back, because they don't really need to go all the way back. You're really trying to hit the hip flexors more. So you can just go back until you feel that lower back hit the ground, and then you can come right back up. And that's going to hit the abs and the hip flexors the way you want them. Another thing that you can do is a leg raise. I always like to use a towel for the leg raise, because you're using your adductors more, and it's going to be kind of a nice co-contraction with your lower abs. So you're just maintaining back flat on the ground, going all the way down to the ground without arching, and hold, come up. Next we're going to work on leg raise progression. So first, what you would want to do, you're reaching up, and at first you're just thinking about bringing one knee up to an elbow. The progression after that is going to be 2 knees to 2 elbows. If you're trying to hit obliques more, you can either go diagonal, or you can just set your body off to the side and come straight up. Next, you would want to do 1 leg bent, 1 leg straight. And finally, you can do 2 legs straight. That's really it for the strengthening. As far as stretching, they're going to have very tight hip extensors. So the main stretch that you're going to want to hit is sitting as tall as you can. You don't want to slump. You don't want to just rotate. You want to be nice and tall and squeeze your knee to your chest and just rotate as far as you can while maintaining a nice tall posture. You can reach behind you. You can put this hand on the ground if you want, but you're trying to feel it right in through your hip extensors and your glutes. That's it for swayback. Thanks a lot.